I've been practicing for over 28 years, and in my practice, I get to see a lot of people with neck, mid-back, and lower back issues. Over 2/3 of the population suffers from neck pain or neck issues at one time or other, and approximately half of the population has experienced lower back pain at one time or other. I believe the BakTrac can help millions of people out there who suffer from neck and back issues. The BakTrac is a great resource that you can use at home to relieve neck and lower back pain. The BakTrac works by opening up the joint spaces in the back and the hips and the lumbar spine. As the BakTrac works, it decompresses and tractions the spine, and while it opens the joint space, it creates a process called imbibition, where the discs center to the middle, the pressure is taken off, and fluid goes back into the disc. This is important because it'll reduce pain by relieving the pressure when nothing else works. Compressive forces usually put pressures on the disc, on the nerves, and on the muscles, and the BakTrac can relieve these issues without the use of pain medicines, which can have a harmful effect if used long term. This process is natural, it's safe, and it's effective. And I believe that if you use this product at home as a home-based therapy, it will yield a very positive effect. As you can see, there's an angle that's created between the spine and the legs. This angle opens up the joint space in the lumbar spine and creates something called decompression. And that decompression relieves the pain caused from the disc, the muscle, and the nerve, and results in great relief to the patient. As you can see, the neck tractioning device is working on the muscles of the neck. It's stretching out the sternocleidomastoids and the cervical erectors. I always ask the patient to tilt their chin downwards a little bit to relieve the pressure off the jaw. What it's doing is creating space in between the discs at all levels of the spine, of the neck, providing relief and reducing any type of radiculating pains that can go into the upper extremities. By tilting the neck down a little bit and pulling slightly down and distracting the joints in the neck, it can also benefit the scapular muscles as well. The cervical tractioning device, when used, doesn't need a lot of pressure to be effective. Just enough to open up the joint space will create a major relief to the patient.